Hey guys, great to see you again. It's Stephen McInday here and I'm joined by the
Dr. Daniel Gordon.
Fantastic, great. So Dr. Daniel Gordon's kindly come along to speak to us today about some of the things that he sees in private healthcare that you might want to know a little bit more about at home. So one of the key things is pain relief. So we see a lot of people in clinic who are suffering with pain, back pain, neck pain, foot pain, all types of pain. And it's important that when they come in that we really understand that they're starting off on the right level of medication for their problem, and these guys are the gatekeepers to the medication. So Daniel, you're a GP.
Yeah, that's right.
Right, so as a GP, how many people a week do you see who complain of pain?
Probably about 50%.
50%,
Yeah.
so quite a lot. What do the other 50% complain of?
Anything.
Anything
else? Usually kind of anxiety, depression, rashes often, and I'd say different kinds of pain as well. So things like headaches and migraines, where I wouldn't necessarily categorise it in the same form of pain, but certainly part of it. And then also all the preventative chronic stuff, say high blood pressure, heart disease, kidney disease.
Oh, brilliant. Interesting. Great. So, with regards to the people, the 50% of the people that you see during the week that are suffering with pain, how would you go about managing someone with pain?
So I think, as we've discussed in the other videos, it's entirely dependent on the person and the kind of pain that they're experiencing. But there are some general rules that we would follow as a doctor. And the first thing is that you always start, we follow something called an analgesic ladder, so a pain ladder. And I would always start on the very bottom of that ladder. And the reason for that is not because we'd want to give you the weakest pain relief, but it's because as you get nearer to the top of the ladder, obviously the pain relief becomes quite strong and the risk of side effects and harm becomes much higher. So you start off with something which has a lower risk of side effects, and also there's kind of on the weaker side of the scale as well. So normally I would start with something like paracetamol or ibuprofen. Those are painkillers with really good evidence bases behind them, and they work really well for most people.
Yeah. So I think a good analogy for you guys at home to understand is the analogy of using a sledgehammer to crack a nut. So with a sledgehammer, it's obviously a big thing. It's definitely going to crack the nut, but you're also going to it's a bit overkill. So going straight for morphine, which is the top of the analgesic ladder, is probably not so sensible. And in the case of the side effects that are associated with morphine, what kind of side effects might someone get if they're going straight to morphine, for example, for pain relief?
I mean, like morphine causes anything from drowsiness, sedation, messes with your concentration. But the key thing with morphine that any doctor is going to worry about is it has addictive properties. And the other important thing with pain relief on that side of the scale, on the top level of the scale, is that there is a good evidence base for using that in things like post-surgical pain or severe cancer pain, but actually the evidence for using it in musculoskeletal pain is really poor, and actually there's a lot of evidence that causes long-term harm and a reduction in return to health. So that's where we have to be extremely careful in prescribing those kinds of pain relief for kind of musculoskeletal pain that comes through my door in a patient that I would see.
So if you've seen someone with like a traumatic musculoskeletal problem, what kind of painkiller would you try and prescribe them for that?
So I would always tell them to take over-the-counter paracetamol, and then I would normally prescribe them a non-steroidal medication, something like ibuprofen, which you can buy over the counter, or naproxen as well. Those medications have a good evidence base in musculoskeletal kind of trauma. They are generally low risk as long as you don't have any medical conditions which mean you can't take them, and generally should be able to reduce your pain levels for enough time to let you recover.
That's fantastic. So there are some medications that you can obviously access yourself, but the video is not really about that. It's about trying to understand why the GP would be prescribing certain medications, because there's a lot of information out there, and you can Google a lot of this stuff about different types of pain medication for different pains you might be experiencing. Obviously the GP is the gatekeeper to a lot of those medications, because in the UK they're prescription based, so you'd have to have a prescription for some of these more potent drugs, as it were, in terms of managing your pain.
Absolutely, and again, for a traumatic injury, if you're going to add something like codeine in, so like a mild or a weaker form of morphine, the rule for kind of traumatic type pain would always be to do it for the shortest possible amount of time, so the lowest dose and the shortest amount of time.
That's interesting, great. So with regards to managing more chronic pain, so what would you what advice would you give to someone at home if you were talking about how they might be managed for their chronic pain?
I think that's a really good question, because I think one of the frustration points for doctors is wanting to help someone with their pain, but also not wanting to go up that ladder to the top level. And the thing I always say to my patients is that I could prescribe you that, but I feel I'd be doing you a disservice, because I have seen so many patients who've started on these medications and then really struggle to come off them.
Yeah.
So I think with chronic pain, I would say it's a much more holistic approach. So it's not about medication, just medication.
Yeah.
So it's about giving you good pain relief, but also making sure that you're seeing a good therapist, and that also you are engaging with other strategies such as, that mindfulness, exercise, applying heat, all the other kind of things that you need to be doing as well. Just seeing medication as the one-stop shop for fixing your pain is never going to get you to where you want to be.
Yeah, so one of the cornerstones of Perfect Balance Clinic is really a three-pronged approach to health. So we talk about the physical aspect of it, we talk about the nutritional aspect or the biochemical aspect, in which case medication might be a part of that. But we also talk about the psychological aspects, and Daniel's brought up a very important point there, that in people with long-term suffering from pain, it's really important that we address what's happening up here as well as what's happening in the actual area that they're perceiving the pain, because ultimately what happens over a long period of time is that we get cortical changes which are almost reinforcing some of the behaviours that we have. So the actual source of the problem might have gone, but the cortical elements of that in terms of the neurological changes may still be there, and often are there in these people suffering with chronic pain, and that's often what makes it so difficult to treat, I imagine. Yeah,
absolutely. I think chronic pain is very common, and it's one of the hardest things to manage, because you want to have a partnership with your patient, and patients can often be quite frustrated with the kind of level of pain they have, and they feel like their wits end, but you also don't want to be led down roads that especially in terms of pain relief medication, that are probably going to cause more harm in the long term.
Good. Is there any advice you'd give to someone in terms of what they do if they're suffering with chronic pain and they're not feeling like they're moving forwards with what's happening?
Yeah, I would say make sure that you see a doctor, see your GP or a doctor that you trust, and be honest about it. I think that's the main thing, is just be honest with your level of pain and your level of suffering, and how it's affecting your life. I think people often won't kind of give that much information to their doctor without a little bit of probing about how it might be affecting their family life, their home, their mood. And I think all of that kind of acceptance of all of that is a lot of the cornerstone of being able to get your doctor or your health professional to help you start kind of unpicking your chronic pain.
Yeah, and it's a great point that Dan has just made there, that actually sometimes people are often quite condescending about the way their doctor's managing it, and it may not be the fault of the doctor. Obviously there's the time pressure with some of these things. That I know a GP has a very limited time in the NHS system, and very limited time to work with the client to get to the root of what's causing the problem. And I think sometimes that's often what leads them to come and see an alternative practitioner or someone outside of the mainstream system. And that's what we get bombarded with a lot, which I'm happy to help people with, but often it's working as a team to get to the root of the problem, and also the complementary therapist or the musculoskeletal therapist working with the GPs to be able to get to the source of what's causing the problem very quickly, so that it's not just musculoskeletal and we keep them coming back for lots and lots of sessions, when actually what they need to be doing is having this kind of three-pronged or multiple approach, to a comprehensive approach to dealing with their chronic pain and the elements of their life that it's affecting. Because it's not just them that it affects, is it? It's their social circle as well, which almost that reinforces the problem a lot of the time.
Yeah, I mean, I think I want to summarise what you're saying as, is basically build a relationship with people you trust, with healthcare professionals you trust. Because if you don't have confidence in who's treating you, then I think you're really going to be very limited in how far you can go. But if you manage to find people that you trust, and that you take their advice and you actually believe in their potential to help you, I think that's going to be the cornerstone to actually getting you moving you towards recovery.
Brilliant, that's been great. So if that sounds like something you'd like more advice on or more help with, then Dr. Daniel Gordon has kindly left his information just in the box below, and you're available to speak to people, aren't you?
Absolutely, yeah, just use the details there on the screen.
Brilliant, so if you'd like more information, just message Dr. Daniel Gordon or leave your details in the box below, and someone will get back to you and pass your details on to Dr. Daniel Gordon. If you've got a specific question and you don't want it to be very public, then you can always message us just by leaving a message, and someone will get back to you offline, and they'll be able to get in contact with you and take more information about your specific problem, so that we can get a little bit more information about you. Now, it's important that you don't see this service as as an alternative to your normal GP. It's in addition. So if you feel like you're a little bit lost and you need more information about what to do next, then just leave your details in the box below and someone will get back to you as soon as possible. Hopefully that's been really helpful today, but for now it's goodbye from me.
And bye from me.
Take care guys, bye.
Bye.